for those of you who are less familiar with the Nuffield Foundation, the foundation is an independent charitable trust. We aim to fund research that informs social policy, primarily in education, welfare and justice. And we believe that robust and relevant evidence has the power to change lives and increase opportunity, especially for people experiencing disadvantage. So we're really delighted to host the seminar today, because we know that the implications of hunger and food insecurity are far-reaching, being related to health outcomes, educational attainment, poverty, inequality and well-being. And it was for those reasons that the Nuffield Foundation agreed to fund an evaluation of universal infant free school meals in 2017, and to fund follow-on work looking at the longer-term impacts of universal free school meals provision in 2021. Alongside these evaluations, we funded the Food Foundation for about a decade to seek solutions to nutritional problems and dietary inequality in the UK. Unfortunately, the cost of living crisis has brought more families into difficulty, which is obviously one of the reasons that prompted Sadiq Khan to provide emergency funding to provide free school meals to all primary school children in London. And the research we'll hear about today sheds light on the likely efficacy of that sort of policy intervention through considering different aspects of children's nutrition. We'll firstly hear from Dr. Angus Holford about new research on the impact of universal free school meal schemes in England. We'll then hear from Dr. Jenny Parnham and Dr. Marie Murphy on the food content of school meals and packed lunches. And before Dr. Hanny Brisden leads us through some key findings from the 2023 Broken Plate Report on the effects of the cost of living crisis and the state of the nation's food system on children. So those presentations will be followed by a panel discussion focusing on what policies work to support children's nutrition during the cost of living crisis. And I'm pleased to welcome Donna Ward from the Strategic Policy Directorate at the Department for Education, who will chair that session. I think I'll leave the panel introductions for you, Donna, if that's okay, rather than do that now. And for those who are here in person, a networking reception will follow this event when it ends at 3:30. So we do hope we'll be able to extend the discussion over cake. And apologies that the online audience won't be able to partake. Next time, if you can come in person, please do. I think we'll better crack on. So I'll hand over to Angus to kick things off. Thank you very much.
Okay, thank you, Ruth. And I'm pleased today to be launching the final project report from Birgitta, Rabe and my Nuffield Foundation funded project on the impacts of universal free school meals in England. This is now live and available on the Institute for Social and Economic Research website. And you know, we wanted to launch it, but also have a debate about what policies can work for children's to improve children's nutrition in the cost of living crisis. Because you know, while children are at school for a good chunk of the school day, consume a good chunk of their daily energy while they're at school, and therefore school meal provision is an obvious policy lever to. Sorry, I'll go closer to the microphone. To improve children's diets. It's not going to be the whole picture, and other research presentations will shed light on some of the difficulties in the school and the wider national food system, and I hope the debate will lead to some discussion around the trade-offs involved. Okay, so in our evaluation, we're looking at 4 local authorities who introduced universal primary free school meals separate from the national scheme to provide universal free school meals to infants. And we're looking at the impact of that on educational attainment, body weight outcomes, absences from school, and household finances. And this is building on our previous Nuffield Foundation funded project on the impacts of that national universal infant free school meal programme, by looking at local authorities that introduce their own schemes that cover the whole of primary school. This gives us the opportunity to do what we couldn't do before and look at a wider range of outcomes, look at impacts on children exposed when they were older and exposed for a longer period of time than was possible in our evaluation before. So a caveat of this research is that it's an entirely quantitative analysis. So we're not going to be capturing the full diversity of the costs and benefits and experiences across children, across different schools. We're showing average impacts here. And all of the outcomes we're showing, our analysis is based on a difference in difference method, the principle of which is to use changes in outcomes over time in other local authorities that didn't introduce universal free school meals as a guide to what would have happened in the places that did if they hadn't have done so. As well as looking at the raw changes, we'll also be controlling for a range of other factors that can potentially affect children's educational attainment and their body weight outcomes that may be changing over time, even within the treated local authorities. Things like the ethnicity of the children, local unemployment rates, and there's other factors like the density of fast food restaurants in these boroughs. And results, we're always going to be comparing with either the whole of the rest of London or the whole of the rest of England as our control groups or comparison groups. And as we report on at length in the paper, we establish that these have parallel trends in these outcomes in the build up to introducing universal free school meals, which is necessary for our method to work. A big advantage of our project is that our analysis is based entirely on data that covers the population of children in the relevant cohorts, or in one case for the expenditure analysis, a nationally representative survey. So our education data is based on, analysis is based on the National Pupil Database from the Department for Education. This is individual level data. For body weight outcomes, we're using school level data, which has been supplied by NHS England, but that itself is an aggregate of individual level data from nurses going into schools to weigh and measure every child in reception and year 6. We're also using Understanding Society, collected by the University of Essex for analysis of household expenditure. Okay, so what would we expect the effects of switching from means tested to universal entitlement to be? So we can mainly think about it in terms of what would be the effects on children who are already eligible for a means tested free school meal, and what would be the impact for children newly eligible to a free school meal only under universalism. And this is a breakdown of what those two groups were doing for their school lunches based on data in these treated local authorities before the policy was introduced. So free school meal eligible children were about 42% of the population. Most of them were already taking a school meal, but 1 in 7 of them were still, for whatever reason, packing a lunch and not taking up what they were entitled to. The rest of the population were not free school meal educated, not free school meal eligible. About 1/3 of them were paying to take a school meal, and the rest were taking a packed lunch. So first, looking at what happened to the free school meal eligible children. So we show in our paper that for this group there was about a 1.3 to 1.6 percentage point increase in take up of school meals for that group. So rounded, that's just under 1% of the overall school population. So we've got this reduction in packing of lunches of about 1% of the population. So for those households, parents are saving time and they're saving money, and more children are eating school meals, so their diets are going to improve by whatever the difference between the content of the school meal and the packed lunch will be. So there's 2 mechanisms by which that group is benefiting there, but that's a relatively small group that's changing. This doesn't rule out that the whole of this group could still be benefiting from the change to the school environment, the switch to a universal setup, or say changes in behaviour by the not free school meal eligible group. So for that group, a lot more changed. So about 32% of the population in total consists of not free school meal eligible children who switch from taking a packed lunch into taking a school meal. So again, that's 32% of children whose parents no longer need to pack a lunch, so they're saving time and money as well. And 32% of the population whose diets are changing, at least at school, by as much as the difference between the school meals and the packed lunches they were previously taking. You've also got this group of 18% who were previously buying a school meal and now don't need to buy a school meal anymore. They're automatically getting it for free. So that group in school hours have got the same diet, but their parents are saving money. And we did some further analysis to try and understand how households were spending the savings from no longer needing to assemble packed lunches or no longer needing to buy school meals. So what we found here was that over the whole of the population, children exposed to the policy were saving about £21 every 4 weeks. But as only half of these families are actually affected by the policy, changing their behaviour, this works out at a saving of £41 per week for each affected child. This is actually slightly more than what it would cost when averaged over the school year to buy a school meal. And we concluded from this analysis that households weren't spending these savings on food, they were spending it on other things that could still be improving the welfare of the children and other household members. And we also think they were reducing their spending on eating out and takeaways. And this could be because they've had a hot meal at school. Parents feel less need to provide hot meals outside of school, perhaps straight after school. Okay, so on to the impacts we find on children's outcomes. So first we looked at reading and maths scores. So we found a significant benefit to reading scores, which is equivalent to making about 2 weeks extra progress by the end of primary school, whether we're comparing with children in the rest of London or the whole of the rest of England. We didn't find consistent evidence of a benefit to maths scores. It depends exactly who you're comparing them with. These coefficients aren't significantly different from each other, so we're less confident about claiming a benefit there. But going back to the reading scores for which we are confident there's a benefit at the population level, it's also important to note that when we break down the population into the free school meal eligible and not, we find significant benefits for both groups. So this includes the free school meal eligible group, for whom hardly any of them actually changed their school lunch behaviour. So this suggests that for educational outcomes, the key thing isn't the changing what the children are eating at school. It's more likely to be to do with the overall change in the school environment. Perhaps that big switch amongst the not free school meal eligible children is improving their behaviour, and that's a better learning environment for all the children in the year. So moving on to children's body weight outcomes. For reception children, we consistently find a significant benefit in terms of reducing the prevalence of overweight, of obesity, and children's average BMI, body mass index. So for obesity, which is the key one, we focus on this effect of 1 to 1.5 percentage points is between a 7 and 11% reduction in obesity from the base of 14%. There's slightly smaller effects in absolute terms on year 6 children. These are somewhat even smaller in relative terms, as the base rate of obesity is somewhat higher for Year 6 children. So this equates to a 2 to 5% reduction in obesity for Year 6 children. We did try and break down the analysis to understand whether the effects on Year 6 children were bigger for children who've been exposed to the policy for longer. We don't actually find an obvious cumulative or adding up effect over time. It bounces around with shocks from year to year, but we do find for children exposed all the way through primary school, the largest and the statistically significant effect there. And we do feel confident in saying that starting free meal provision early and having it all the way through primary school is likely to maximise the benefit to children's body weight outcomes. So some bad news from the research to some extent is a finding that when we split schools into those that before universal free school meals was introduced had pre-existing high levels of obesity and those with lower levels of obesity before universal free school meals were introduced, the benefits don't actually extend to this high obesity group. And this does suggest that, in the more difficult environments where obesity is already more entrenched, universal free school meals are going to need to be part of a wider package of support to try and improve health outcomes in those places. A more positive view of this finding could be that these lower obesity schools are more representative of the environment faced by a lot of the rest of the country, because obesity is lower in the rest of the country, it's less deprived. So if the policy was rolled out more widely, it's possible that these effects on the low obesity schools would be more representative of what would happen. So we also looked at absences, and while we found quite a few statistically significant effects because we had an absolutely vast data set, because we had an observation for every child for every year, it was 6 times the size as what we had for the reading outcomes. We did find some significant effects, but we wouldn't argue that any of these are materially large. So at most, there would be 1 school day lost per child for every 4 years of school they attend. This is quite a minimal effect. And 1 child in 110 is no longer persistently absent, which here is defined as missing more than 10% of school days. Okay, so in summary, we think that we show a lot of evidence in support of the whole school environment being key here. So there's educational benefits of universal FSM that extend to all children, including the already FSM eligible. And this could be because of spillover effects through behaviour or the social benefits of eating together, and there's no longer this stigmatised environment. But as we saw, the health benefits don't extend to the already high obesity schools, so additional support is likely to be needed in those places. But we do find a wide range of benefits of universal FSM. So it ensures that all children have access to a nutritious meal every day during school hours. We show that there's a financial benefit or cost of living support for about 50% of families. Fewer children are living with obesity during and at the end of primary school, and they're making 2 weeks extra progress in reading. And coupling our research together with what we understand from other evidence about how early and childhood conditions track through to later outcomes, we would expect there to be longer term benefits from this, both to the individual. Children who have better scores at the end of primary school do go on to have higher lifetime earnings. Even delaying the onset of obesity in childhood reduces the risk of later life diseases. And both of those things, high lifetime earnings and better long-term health at the individual level, will add up to benefits for society as well. So higher productivity, as obesity and related conditions can be a drag on earning potential, but also lower NHS and healthcare costs. So to embed these benefits probably does require continued high take-up of high-quality school lunches. You know, the obesity results depend on that, and the school environment being one in which taking a school meal is a norm requires that. So this requires steps to make sure that the school has an attractive and social dining environment. This may need staggered lunch times to make sure children aren't spending their whole lunchtime queuing. An emphasis on the healthy rather than the free element of school meals, and treating the school lunch together as an integral part of the school day may be necessary. Unfortunately, it is probably also likely to require significant capital investment in improving and enlarging kitchen and dining areas. You know, and last of all, the per pupil funding for universal infant free school meals hasn't kept pace with the inflation that is driving increases in food costs, increases in staff costs, utility costs. All of these need to be met in the longer term to ensure the differences between what children are having as a packed lunch and what they're eating in their school meal are maintained. Okay, that's all I've got to say. Thank you very much. And I did build in a couple of minutes for any questions if anyone has any. Barbara?
Why not? Thank you, Angus, so much for your presentation. I'm really interested in the reading scores that you tracked. And I guess being a devil's advocate, is this an actual really expensive way of trying to get those changes in reading progress? How does it compare to other investments, and have they been, how does the benefits in reading compare to any evaluations of other benefits in reading? Do you have any idea on that?
Okay, so these effects, it's about a half the size of the literacy hour when that was introduced, which devoted an extra hour, or it made sure there was an hour every single day to focus on reading skills in school. So that was the cost benefit ratio. The literacy hour was much higher than this because that was a low cost intervention that involved reorganizing the school day. So maybe I wouldn't frame it in terms of cost effectiveness. I would just say that it is effective when compared against an event whose primary aim was improving reading scores. To have this as a bonus as well for a policy that's benefiting children in terms of their health as well, and the benefits to the finance of families. Stephanie. No. Anyone got the mic?
Thank you. I've just got a question about reading and maths too. Did you look at timetabling? Is it something as simple as readings in the afternoon and maths in the morning? Yeah. Or is that too simplistic?
So unfortunately, we don't have any access to to how schools are organising their day. I mean, there's no reason to believe that there would have been a shift in timetabling specifically in those local authorities at the same time as they introduced universal free school meals. That means we'd be worried that that was driving the effects rather than the shift to universal free school meals. But yeah.
Thank you. It's just that obviously the breakfast, managed breakfast often talk about maths and English being in the beginning of the school day, and obviously breakfast having an impact. And I'm just wondering if reading was in the afternoon in some cases.
So yeah, I don't know about that, but yeah, we do account for the presence of a universal breakfast programme in our set of controls in this project. Okay, I think it's time to change over to the next presentation to make sure we keep back on time. But thank you very much for
a tough act to follow, so I'll try my best. Acknowledgement. So did you need to? My name is Jenny Parnham. I'm a researcher at Imperial College London, and together with Marie Murphy, we're going to give some context to these findings. So I'm going to present my work that just briefly describes the content of school meals and packed lunches in the United Kingdom. Now, I know everyone in this room and online is well aware of the differences of a school meal and a packed lunch, but because it adds some context to why there might be nutritional differences, I'm just going to run through them very quickly. So school meals, they're covered by statutory food standards in every school. They can be free depending on the income or the age of the postcode area of the child, and they're typically served as a freshly prepared hot meal. Whereas packed lunches, I hope I'm not hiding anyone's view, are not covered in any national statutory guidance, while individual schools might have policies. It's not necessarily consistent or government mandated. They're dependent on family resources. That could be their time, their facilities, their equipment, their money, and typically, again, served as a pre-prepared cold food that's brought in. The school food standards that govern them are food-based and generally denote portions that can be served throughout the week, restricting foods that are high salt, fat and sugar. So these are important areas to look at when comparing. But one thing they don't necessarily specify is the amount of processing. So we also thought it would be interesting to look at the amount of food processing in school meals and packed lunches. I guess this is a relatively newer concept in dietary research. So just to say that more of the food that we eat is processed in some way, but start to think that the amount that is processed is important, with particular concern just around this ultra-processed food category. These are foods that have been industrially produced with processes that you can't do in the standard kitchen, or containing kind of artificial non-nutritive ingredients that you wouldn't be able to find in an average store, and not even big Tesco. And so these foods are really designed to be hyperpallative, attractive, cheap, long-lasting, which obviously has some benefits. But they've also been started to associated with negative health benefits in children as well. And yeah, worth noting that oftentimes a minimally processed food item would have an ultra-processed version. So, you know, a food-based snack could be just some strawberries, or it could be a strawberry fruit grinder. And you can have bread made at home, or ultra-processed bread. So it's worth also examining the amount of processing as well, because that might not be captured just in the school food standard food grouping. So to do this, we used national dietary survey data. We had data from about 3,300 children around roughly a 10-year period. We were able to extract just the data that they supplied on their lunches consumed at school, and categorised them as a school meal and packed lunch. And we compared them in terms of the food groups that they contained, the nutrients, and also the processing level of the foods that they ate. So the first results, these are the food groups as stated in the school food standards. And we can see that school meals, if this is on the line, it's more preferable, it's more likely to be in a school meal. So they're preferable in terms of containing vegetables, a protein-rich food, preferable in the sense that they're less likely to contain savoury snacks and sweet snacks. When we looked at it, but they're actually less preferable in the sense that packed lunches were more likely to contain fruit, whole milk products, or dairy products. When we looked at it in terms of whether they were likely to meet the old nutrient recommendations in the school food standards, Packed lunches were more like, school meals were more likely to meet recommendations on sugar, saturated fat and salt and fibre, but packed lunches were more likely to meet recommendations on calcium. And then we had our results on the level of processing in these meals. So this is quite a busy graph, but it basically says the amount of minimally processed and ultra-processed food as a percentage of the total calories eaten at lunchtime in packed lunches and school meals in primary school children and secondary school children. So 3 things that you can take away from this graph being that no matter whether it was a packed lunch or a school meal or a primary school student or a pupil and a secondary school pupil, over 50% of the food that they consumed came from ultra-processed foods. The second thing to note is that there was a big difference in terms of school meals and packed lunches and the amount of ultra-processed food they consumed. In primary school children, this is a 20 percentage point difference. And the last thing is that in school meals, there was a slight increase in the amount of ultra-processed food consumed between primary school and secondary school. And lastly, just to say we did look at income differences in the amount of ultra-processed food consumed. So we can see here the kind of how steep this line is, denotes a strong income inequality. So this was particularly evident in secondary school children, in that the lower income groups were more likely to have higher amounts of ultra-processed food than the high income children. And this level of income inequality was also apparent in primary school children in their packed lunches, but interestingly, in the school meals of primary school children, this income inequality seems to have been mitigated. So it raises interesting questions about the possibility for school meals to reduce inequalities. So to quickly summarise before I hand over, school meals are typically healthier than a packed lunch. This is regardless whether we look at them in food groups, nutrients, or the amount of processing, as is similar with other research done in this area. It's important to note that there's still room for improvement, and definitely all the results that Angus suggested, if there was small improvements, I'm sure that that would definitely maximise the results that we've seen today. And lastly, school meals could be a way of mitigating social inequalities that we see in dietary intake. So thank you for listening, and I'll pass over to Marie.
Thank you. So I'm going to give a really quick overview of the findings from a research study that we carried out called the FUEL study, which was an evaluation of national school food policy in England. So to give a really quick whistle-stop tour of school food policy in England. So in 1941, the first school meal policy was introduced, and since then there have been various iterations of school food standards that aim to improve the nutritional quality of food provided during the school day. And so the school food standards in their current form were introduced in 2015, and these became a legal requirement for schools. At a similar time, the school food plan was also introduced. And this was non-statutory guidance from the Department for Education. And this set out some actions that schools could take in areas such as school leadership and governance, in food education and the eating environment. And it was about supporting schools to develop a healthy eating culture and ethos, and also about increasing school meal uptake as well. And these policies sit alongside policy on free school meals. And the success of the free school meals programmes are very much dependent on the provision of high quality food during the school day. So moving on to the FUEL study. So we carried out this research from 2019 to 2022. And these are the research questions that we set out to answer. So it was completely focused on the secondary school context. We wanted to know how well do secondary schools comply with the national school food standards, and how well do they implement the school food plan recommendations. We also wanted to look at whether the compliance with the school food standards was associated with the nutritional intake of pupils. And we also carried out some qualitative research to try and understand how do schools provide healthy food and how do they support healthy eating, and their perspectives on how this influences the diets of students. I'm going to be focusing on the school food standards element today rather than the school food plan. So this was our study design and sample. It was a cross-sectional observational study. I'm going to jump, in the interest of time, straight to some key numbers here. So this research was carried out within secondary schools in the Midlands. We recruited 36 secondary schools and we spoke to over 2,000 young people. And we also visited 4 secondary schools as case study schools for our qualitative research as well. And this is an overview of the methods and analysis that we carried out. So we looked at the food provided in secondary schools through reviewing the menus and also through observation of the foods and drinks that were being served in the canteen across one day. And we assessed the food provided against each individual school food standard. And the school food standards exist for or apply to foods provided at lunchtime. There's also a group of standards that apply to foods that are served outside of lunchtime, so for example break time and breakfast, and also some standards that apply across the whole school day, for example the drinks that are provided in school. So we looked at whether each individual standard was met, and we also divided the standards into 2 categories as well. So we looked at school food standards that were designed to improve dietary variety within a school meal. So this might be limits or increasing the range or number of fruits and vegetables provided or whole meal varieties provided. And we also looked at standards that aim to restrict the consumption of foods and drinks that are high in fat, sugar and salt. So this might be, for example, reducing or limiting the sugary drinks that are provided, or the availability of confectionery items and cakes and cookies and those types of things. So in terms of nutritional intake, we collected dietary data from pupils using an online 24-hour diet recall tool called Intake 24. And we used multi-level modelling to explore the associations between the percentage of dietary standards met, so compliance with the standards, and a range of dietary outcomes that you can see here. And we looked at these dietary outcomes at 3 time points throughout the day. So intake during school lunch, intake across the full school day, and then intake across 24 hours as well. And we controlled for a number of school and individual level covariates as well. So moving on to our findings, when we look at compliance, within the secondary schools in our sample, we found that no schools were 100% compliant with the school food standards. On average, schools were compliant with 64% of the standards that you can see on the far left there, the orange bar. And then on the right-hand side of this graph, you can also see that there was variation in compliance with particular types of standards. So we see the highest compliance for standards that apply to lunchtime, and we see lower compliance with standards that are designed for mealtimes outside of lunch, so for example, break time and breakfast, and lower compliance with those that apply across the whole school day, for example, having compliant drinks available. And then when we look at the standards as they are divided into these 2 categories, again, we see variation. So we see higher compliance with standards that are designed to increase dietary variety. So, for example, having a range of fruits and vegetables available. But we see much lower compliance with standards that are aimed around restricting high fat, sugar and salt foods. And so compliance with those standards was on average under 30%. Okay, so when we look at the relationship between compliance with the standards and nutritional intake, I'll give a really quick overview here, although I should say I've been quite selective here in what I'm presenting because of the time constraints. If you would like to find out more, then please do get in touch. So overall, we found that there was not very many relationships between compliance with school food standards and the dietary intake of young people. But for those where there were a significant relationship, I've just highlighted those here in this table. And this shows the regression coefficients from the models. And I'll just highlight here, we see for when we look at the dietary variety standards, we see when there is higher compliance with these dietary variety standards, we see lower intakes of energy and fat. But in contrast, we also see lower intakes of fibre and higher intakes of energy from free sugars. And that's mainly around lunchtime, but also for those for fibre and free sugars, that is across the whole school day. And then we look at the relationship between the compliance with the restrictive standards and dietary intake. So we see that there is an association between, a marginal association between high compliance with these restrictive standards and actually higher intake of free sugars over a 24-hour period. And we also see a marginally higher intake of confectionery items across the school day and over a 24-hour period, which we thought was quite an unusual finding. So some of the conclusions that we've drawn from these findings are firstly that secondary schools are not able to fully comply with the current school food standards, and particularly those for mealtimes outside of school lunch and those restrictive standards. We also find that the standards have not been particularly impactful on the nutritional intake of pupils, although this should be caveated with no schools being fully compliant and not being able to assess full compliance. And then there was also this query around whether higher levels of restriction with those standards around high fat, sugar and salt foods might be associated with higher sugar consumption outside of the school environment, or with the food that's being brought in from school that's perhaps from home or being consumed outside of the school day. So we also spoke to schools to collect some qualitative data on this, around some of the challenges in providing healthy food and in meeting the school food standards. We found that schools were really keen to offer healthy food and saw themselves as having a really important role, but they described challenges in the secondary school catering system. And so this was centred around balancing the provision of healthy food or healthy options with having an appealing offer for students, meeting their needs and preferences, and then also managing to have viable levels of school food uptake and generating enough income. So, for example, one caterer said it's a balance of keeping the kids happy, but also sticking to being healthy. It's a balance of getting your sales, but also trying to stick to being a healthy school. And then when we look at the pupil perspective, the students that we spoke to described negative eating experience within their secondary schools. And so this was generally related to the time available for choosing and eating their food. And this created a lot of anxiety for adolescents and also made it difficult for them to make healthy choices. So one student said, the thing with looking at the ingredients, if you want to look at them, you have no time because they're shooing you along, hurry, hurry. And then this should also be mentioned that schools did see a limit to their role. And so they also saw environments outside of school as being really important, and particularly having access to affordable food for families and the eating environments outside of school as being a key factor in the diets of adolescents as well. So in summary, the implications that, that we generated from this are that national school food standards are challenging to implement in secondary schools. So there may be a need to adapt national school food policy, but also think about how food is provided in secondary schools and how schools can better be supported to provide healthy options that meet pupils' needs, but also enable them to maintain financial viability. And that this needs to be done within a much wider system, food system as well. So school food just sits within a much wider food system that also needs to change. I'd like to acknowledge the co-investigators on this study and also the Chief Investigator, Professor Miranda Pallam, and also our funders, the National Institute of Health and Care Research. And I'd also like to give a shameless plug for an event that we are holding on the 20th of March in Birmingham. And this is around achieving healthier food policy and practice in secondary schools. What next? And there is
a link that you can register on here that I'll hopefully be able to share in some way. And but if you'd like to find out more, please do get in touch. Thank you.
Hello, thank you very much for the invitation to speak today. And it's kind of a bit strange for me because we do a lot of work on free school meals at the Food Foundation. And today I'm not talking about free school meals, despite the fact we've had 2-3 excellent presentations about it. What I'm going to be talking about is the wider environment, the wider food environment that we live in, that children are exposed to, and that impacts on their health. I'm primarily going to be drawing on the Broken Plate report, which is a report that we published every year. We published the last one in June. Next one's coming out next January. So yeah, I don't have the clicker. Yes, I do. So at the Food Foundation, our sort of strategy is based around improving food systems, and we focus primarily on 3 key areas. So we look at the appeal of food, the price and affordability of food, and also the availability. And it's through this lens that we look at the food environment and how it impacts our health and our children's health. The other thing that we do at the Food Foundation is tracking of both food prices and also of food insecurity. And in the context of the cost of living crisis, both of these are really important pieces of data to look at where sort of intervention is needed, and to really highlight how important it is to make sure that children and families in particular have access to healthy, nutritious food. So we've been tracking, I'll move over actually so you can see properly. We've been tracking a basic basket of goods since 2022. This is a picture of the basic basket of goods. And as you can see, there's been quite a significant increase in the prices of that. We are seeing a little bit of a decline at the moment, but when you consider how much it's increased by, around 25%, this is quite worrying, particularly for the sort of lower socioeconomic groups, the most deprived communities. Then moving on to food insecurity, again, you can see since the beginning of 2022, this has increased quite significantly, particularly in families with children. We're looking at around 1 in 4 families with children are now faced with food insecurity, which is of course in part due to increasing in food prices, but also just the increased cost of living. And this is, as I say, really worrying, and I'll show a few more pieces of data that show the kind of widening of the gap between the most and the least deprived people in our society. So the Broken Plate report is our, as I say, our flagship report where we look at different aspects of the food environment around those 3 areas I said: appeal, availability, and affordability. So in terms of affordability, one of our key metrics looks at the percentage of disposable income that a household needs to spend to afford the Eat Well guide. So this is the recommended diet. And what you can see, well, there's 2 key things we can see here. One is that in all income quintiles, which are these ones along the bottom, you can see that the proportion of our disposable income that has to be spent on food has increased. And we can also see a really big difference between the lowest, the most deprived and the least deprived group. So 50% of the disposable income in the most deprived groups needs to be spent to afford the Eat Well diet, and then 11% in the least deprived. Then the cost of healthy food, what we can see is all food has increased in price, but again we can see a bigger increase in the healthier food. So this becomes challenging because when people are faced with high cost of food, and we're seeing that the less healthy food is significantly cheaper, that's of course what people are forced to sort of buy and have, which then has health outcomes, which I'll come on to in a minute. It's not just about what we buy sort of in the supermarkets either. So the environments that we live in, the fast food chains around us, what's on a high street is really important as well. Around 1 in 4 outlets on the high street are fast food outlets. And again, we see a big difference between the most and the least deprived areas, with 30% of the fast food outlets in the most deprived areas being most 30% of the food outlets being fast food in the most deprived areas compared to 20% in the least deprived areas. So again, this builds a picture of how the most deprived groups in society are most impacted by the sort of the poor food system that we have. Food that children eat, again, we know there's a lot of sugar, a lot of salt packed into food that that our children are consuming regularly. There's a little bit of good news on breakfast cereals, where the sugar has come down over the last couple of years. But what we can see for both breakfast cereals and yogurts, which are relatively staple products, you expect them to be healthy. We're not really thinking of them like chocolate bars. These are like our healthy foods. You can see how little of those products are sort of coming out as low in sugar. So again, showing this is what we're just consuming in our everyday life. Marketing of baby and toddler foods is another key area that we look at, and research that was carried out by Action on Sugar for our report found that 97% of the snacks that are marketed to toddler and children have some form of health claims. Some of these are about health, some of them are in terms like organic, which may be true, but all of these kind of give the perception that something is healthier than it is. So this is worrying. You can see all the sort of highly processed foods that are marketed to toddlers. So even before they've gone to school, they're exposed to a lot of processed foods, often very high in sugar. And one thing that we see particularly in baby food is the sort of the explosion, as it were, of pouches. Often even the savoury ones, particularly for the sort of the weaning phase, they'll say a vegetable name on the front, but when you look at the ingredients, the first ingredients is apple or pear, something like that. So from a very young age, we're exposing children to very high sugar diets. Advertising, so we know advertising impacts what we eat. There's a lot of evidence to show, and it's why so much money is spent on it. But a third of food and soft drink advertising spend goes towards confectionery, snacks, desserts, and soft drinks. So all those discretionary products that are not part of a healthy diet, that's what's being advertised. There's a lot of brand advertising, which obviously creates positive imagery about certain brands, usually the ones that sell unhealthy products. And this compares to less than 1% of fruit and vegetables being advertised. So you can see a really big disconnect between what we're sort of seeing as we walk down the high streets, in what we kind of want people to be eating more, want people to kind of just eat, and the food that is, as I say, discretionary and not necessary for a healthy diet. And this, of course, all impacts on what we do eat. So the three graphs over here, these fruit, veg, oily fish, and fibre, this is what we should be having a lot of. Fat, salt, sugar, what we should be having less of. And the dotted lines show the recommendations. And you can see for all of this good stuff, we are below, and all of the bad stuff, we are above. And then again, in most of those groups, you can also see a really big difference between the most and the least deprived groups in society. So particularly for sort of sugar and salt, there's a higher consumption in lower income groups, and then lower consumption of fruit, vegetables, fish, and fibre. So ultra processed foods, this is a big topic at the moment that you'll hear a lot about. It's basically food that is highly processed, but 56% of calories consumed from ultra processed foods in older children, calories consumed are ultra processed. So this is a really high proportion of our diet is from processed foods that often have things added sugars, salts, and also preservatives and additives. So that just shows you how our diet sort of it has become, and also where we sort of sit internationally. So you can see we're doing quite badly as well. We have a lot more processed foods in our diet than a lot of other countries around Europe. Now, this, of course, all leads to poor health outcomes. So children's dental decay. Now, I personally always thought of dental decay as something that adults got, but actually almost a quarter of 5-year-olds have dental decay. And there's a really big difference again between your lowest and your highest income groups. 35% in the most deprived areas, have had to have sort of treatment or something for dental decay, compared to just 13% in the highest group. Children's growth. So this shows the sort of lowest income, the highest income groups. What you can see is, again, the disconnect and the difference between the lowest and the highest income groups. And I haven't got the graph here, but we're actually, for height, we're actually a lot shorter than a lot of other countries around the world. And we know that poor diets is one of the causes of sort of shortness, as it were. Children's weight. I mean, obesity is something that a lot of countries around the world are affected by at the moment, but one in 5 children are starting primary school already affected by overweight or obesity. So this shows just how big of an issue it is, but also how much we need to be focusing on both the early years and also older years when we're looking at interventions. And there's a big difference, again, between the most and the least deprived groups. So when we're talking about cost of living crisis, when we're talking about diets, it really is those lower income households that are most affected and that we really need to be targeting interventions to. And this is why things like free school meals are so important for those groups. So that's a kind of a quick whistle-stop tour of the Broken Plate report, which includes all of these metrics that map different aspects of the food system and hopefully kind of shows where free school meals kind of fits in, but also why it is so important that we are helping those groups. And as an organisation, we sort of do a lot of work in sort of policy and influencing as well as research, and we're obviously doing a lot of work to push towards making healthier diets more affordable, more accessible for all, making sure that we are investing in children's diets and really thinking about the sort of the current and future generation and making sure that, you know, a lot of these trends are getting worse and we need to really put a halt to that and make it better. And we need to be supporting people to eat more sustainably. And this is we do a lot, we kind of advocate for a lot of policies which are quite, you know, tweaking around the edges, but we also need to be looking at the food system as a whole and really sort of making some bold decisions about how we improve the food system for everyone. So I'll stop there. The report is online. I'm going to have a technical annex that sits alongside it, which has all of the methodologies that we use for Broken Plate. Just a big thank you to our partners on the report, but also in particular to the Nuffield-funded, who, as said at the beginning, have supported us a lot over the last few years, and in particular, the Broken Plate report is thanks to their funding. So thank you very much, and yeah, over to the panel, I guess.
Okay, can everyone hear me okay? Okay, so good afternoon, everyone. I'm Donna Ward. I'm Director of Strategic Policy in the Department for Education. And previously I worked for 5 years in DWP, Department for Work and Pensions, on child poverty. So these series of presentations have been really fascinating for me, both from the education and the poverty angle, but also very much on child health, which I think is probably the #1 issue in society right now. So huge thanks to Hugo, Jenny, Marie and Hannah for those excellent presentations. So that's given us a lot of food for thought, excuse the pun. So I'm now going to just allow the panel to quickly introduce themselves, and then I'll come back to what this discussion's about and how you can participate. So if we just all briefly introduce ourselves, thanks.
Thank you. I'm Caroline Cherney. I'm Director of Policy at Bite Back, which is a youth activist movement focusing on improving the food system.
I'm Ben Cadsby. I'm Head of Policy and Research at Impetus. We're a funder focused on young people from disadvantaged backgrounds and supporting them in education and employment. And I'm also an Associate Fellow at the think tank Bright Blue.
Hi everyone, I'm Kate Anstey. I'm the Head of Education Policy at Child Poverty Action Group, and we work on behalf of children across the UK who are growing up in poverty.
Hi everyone, I'm Councillor Jasmine Ali. I'm the Deputy Leader of Southwark Council, and I also look after children, refugees and education. Good to be here.
Brilliant. So thanks so much. We've been given a really broad topic to talk about, how society can best ensure that all children have access to good nutrition. So I'm sure we can take whichever angle is most interesting and whatever's been sparked by the excellent presentations before. We're going to ask every member of the panel just to give a few reflections. That is optional if you decide you don't want to. And then we're going to open it to questions. Louise is very kindly on standby to try and gather up questions that have come through the chat as well. So, and I think so far we're actually running to time. So Hugo, that's got to be an achievement. So we'll try and keep this whole session about 45 minutes or so, but see how we get on. So if everyone's happy with that, Caroline, would you like to give a few?
Yeah, sure.
Get us going.
I mean, I think I started the listening to this presentation feeling quite optimistic. Angus's research was really, really exciting, showing the potential for universal free school meals on, a range of really good outcomes, particularly childhood obesity, which some of you will know before Bite Back. I work with the Obesity Health Alliance, so childhood obesity is something I'm very interested in. And I think kind of my role on the panel today is to advocate for older children as well. At Bite Back, we focus on teenagers. And so much of what we heard about the school food standards in secondary schools really resonated with what we hear from our youth activists at Bite Back. Often there isn't even a lunchtime. There are 2 short break times, and the food they grab is the food that their friends are eating, the food they see advertised to them out of school. So it's it's pizzas, it's sausage rolls, things they can eat on the go. And I think what we need to do is stop thinking in silos, and we see this a lot in a lot of government policy. I'm sure Donna will have some interesting things to say about this. The fact that school food sits in Department for Education, when there's such a big opportunity for health with school food. And I guess my reflection is how can we start thinking about that much more kind of complex adaptive system. Caterers say that they're serving the food that children want to eat. They just got to be there to make money, and we saw that in the reflections from the qualitative research. So how can we fix that system so the food that the children want to eat is the food that's available, is the food that's accessible and affordable to them, both in school and out of school? And it's a really big problem. But I think particularly with older children as well, who often get left out of the policy debate when we talk about children, we need to think about food as being more than just nutrition. We know it's so important for them from autonomy. Once they get to their teenage years, they have they want to assert their autonomy in terms of the food that they eat. And it's also really social as well. They eat what their friends eat. They go where their friends want to go to eat. So I think there's loads that's given me cause for hope, particularly among younger children, when we know that the age that when children kind of go into puberty, that their weight status is really important in terms of their trajectory in later life. And I think there's some really exciting positive things coming out of the research today, but we also need to really fix the quality, the advertising, the wider environmental system. Otherwise, we're kind of sending children off the cliff edge, once they leave primary school.
Thanks so much, Caroline. I'm so pleased that you mentioned older children and teenagers. That's really important. I was going to ask Hugo whether you might consider following people through into secondary school, given that the universal free school meals are all focused at primary schools, school children, to see whether those gains can be sustained. Are you?
Yes, good. So there's no national child measurement programme for secondary school children, unfortunately, which means for the obesity and body weight outcomes, we can't address that. But I've done it in my research before, of waiting till a cohort grows up and you measure their outcomes later on. We'd love to see if the children exposed to the universal free school meals, if there is a benefit that persists beyond the pandemic. That's going to be the challenge. The pandemic has changed so much that it's going to be really difficult to detect if these effects persisted beyond that. But I'm up for the research challenge.
Excellent. And just to also clock in people's minds before we move on, I was doing some work on children's mental health and well-being for the department, and one of the things that really stood out was the massive increase in eating disorders amongst teenage girls, especially, also boys to a lesser extent. And that seems to have been a COVID effect, following a big increase in child obesity during COVID. So there's just so many different layers actually to this problem. But thank you so much, Caroline, for making us think about teenagers and older children. And we've got some other issues there, and then we'll move on to Ben.
Thanks, Donna. If Caroline's job is to talk a little bit about kind of older children and teenagers, I think my job is to be relatively sceptical about universal free school meals, which is going to be relatively interesting in a room like this. I come at this from an education background, and I just want to make a kind of few hopefully helpful observations. With policy, it's always helpful to ask ourselves the question, who are we trying to help and what are we trying to help them to do? And I feel like part of the reason universal free school meals is so popular in principle is it brings together people that have lots of different interests. We've talked a little bit about academic benefits, we've talked a bit about nutritional benefits, we've talked about cost of living benefits, but there are relatively few policies that bring together kind of advocates of all of those different kind of streams. I guess it's just worth touching a little bit on some of those. I mean, the key thing to remember about free school meals is the poorest kids in society basically are already getting free school meals. So when Angus talks, for example, about the kind of people that are now getting free meals that were previously paying, they're saving money, like that benefit is going to people who are not currently in the kind of poorest group of society. And there's some really interesting stuff we could get into about whether the threshold for eligibility is right, why the DfE hasn't got around to auto enrolment yet since we've got DfE people present. Like, there's lots of good stuff we could do there. It wouldn't cost a kind of £1 billion a year, which is what the Institute for Fiscal Studies says universal free school meals would cost in primary. I think it was £2.5 billion if you want to include secondary as well. So shopping list gets quite long. Poverty is a real problem. The solution to poverty is not schools. The solution to poverty is benefits. There's loads of really good work out there from Bright Blue, the Centre for Social Justice, Joseph Rowntree Foundation. There's a minimum income standard. Why are benefits not higher? If you want to solve poverty and tackle poverty, I don't think you should lump it on schools. I think you should be looking at the benefit system and thinking how best to do it through that. Thinking about schools, Barbara, I think it was asked a really interesting question earlier about the kind of 2 weeks of academic attainment. It's really interesting. So the EEF, which is the What Works Centre for Education, they usually measure additional progress for educational interventions in months rather than weeks. I don't know if they would round 2 weeks to 0 months or 1. If it's the former, that makes universal free school meals about as effective for attainment as setting children by ability. If it's the latter, it's about as effective as performance-rated pay or physical activity. There is a reading comprehension strategies strand to the toolkit, which leads to 6 months of additional progress. So 2 weeks is, I think Angus described it as a bonus. Like, it is a bonus, but like, let's be clear, it's not the priority here. And finally, I just want to talk a little bit about pupil premium. Schools get initial money for educating pupils that are eligible for free school meals. If you make everybody eligible for free school meals, you start to lose that ability to kind of target those extra resources at the schools serving the most deprived communities. Education Data Lab have done some kind of analysis on this based on the London boroughs that have already introduced this policy, and schools are losing out on kind of thousands of pounds. And if you scaled this up to England as a whole, schools would probably lose out on about sort of £35 million a year of additional funding for educating those pupils. Let's not make schools solve poverty. Let's use the benefit system to solve poverty. Let's target our resources where they're needed most. So that would be my suggestion.
Thank you, Ben, and I especially welcome those comments now that I'm not in DWP. I pass it over to my successor, James Wolfe, to deal with that. But that's great. Thanks for stirring things up for us, because we don't want to all be sitting here in violent agreement. There's always pros and cons and trade-offs to every policy. That's one thing I've definitely learned over the many years in the civil service. So thank you. Kate.
Yeah, happily follow on from that. So I think at Child Poverty Action Group, we would wholly agree that the best way to lift children out of poverty and to help families is through the benefit system and through social security. Just to name one policy that would do a big job in helping families, if you removed the 2-child limit, overnight, you would lift 250,000 children out of poverty. So I don't think we're at odds that that is the most effective way to support families. But actually what we do at Child Poverty Action Group is we look at other policies that we think will make a big difference to children's lives. children spend a lot of their time at school. They spend a lot of their time, sort of at school with teachers, with their friends. And I think what we've seen from our research with children and families is actually there are lots of things you can do within the school day that make it more enjoyable, that make it more accessible, that mean they're more able to engage and achieve. And I think there is this tension that we always have, kind of linking back to Barbara's question about, you know, is free school meals the answer to the attainment problem? Is it the silver bullet? And of course, there are going to be things that if we fund them, they may have this greater impact on attainment. But I think what we're talking about is free school meals being this kind of enabler for children being able to get on in school. There's lots of things that have come up already that also come up in our research around children being able to sit down together, socialise, enjoy the same food in the same way. And I think, it's just really about sort of saying this policy has a really good effect on children, on all children. It disproportionately helps lower income children. It really helps out families who are struggling financially. It takes that burden away. It gives them one less thing to worry about. I'm just going to finally pick up on a few things. We very recently published a report with the NEU that looked at some of the more kind of underexplored benefits of free school meals. And one of the things that came up a lot in that is this issue of taking away worry around dinner money debt. We have this huge challenge where lots of families are actually unable to pay for that free school meal. Sorry, not free school meal, they're unable to pay for that meal, and they're accruing lots of debt as a result of this. And schools are in this really challenging position where they're kind of having to work out whether to chase families, spending time in the morning following this up. And it's really having a detrimental effect on the relationship between home and school. And this is families kind of not necessarily the very lowest income families, but lots of families across the kind of income spectrum are struggling with the money that they need for school meals. So I think there's kind of these just multiple things and reasons why universal provision just helps out families and children, and it's also a good thing for schools.
Thank you. Thanks very much, Jasmine.
Yeah, first of all, I just want to thank the Nuffield Foundation, all the organisations here today, Angus and Birgitta, for their fantastic and helpful research. Look, we know there are hungry children. There are millions of them. I mean, basically, a recent survey by the Food Foundation said, you know, that basically 17% of households in the UK were in food poverty. 1 in 4 families with children were struggling to get enough to eat. Malnutrition has doubled in the last decade, and food prices soaring 20% this summer is what we've seen. So, you know, in a society, it feels like we're in profound decline because we see falling incomes, decline in health, and we see a pervasive sense of moral collapse. Hungry children must be the clearest possible indictment of our society. So don't worry, I'm not going to give you a lecture for the whole of the 2 minutes that I've got. But in Southwark, this is important because we have to get on with it really. Because in Southwark, we have been waging, you know, under a Labour administration, my administration, we've been waging a fight against this food poverty in our schools for the last 10 years. So, you know, in response to austerity, when we first took power in 2010, we could see that families were just cracking under the strain and they were really collapsing. So we came in and we said we're going to give free school meals in basically in every primary school. And then we were wondering, well, we piloted it, obviously, because we're a good local authority. And we saw that, you know, basically it was just a no-brainer to us because we saw, you know, some of the benefits were that it improved pupils' concentration, the behaviour in the class, it increased the amount of fruit and vegetables, reduces the amount of sugar and encourages, you know, children to find new foods. And when we get on later, I'll explain what we've done with the free healthy school meals. But, you know, it was a no-brainer to us. We rolled it out in nursery schools. And guess what? You know, with Sadiq Khan, that came along, the cavalry came in, and he basically paid for free school meals for all London boroughs. So with that money, I've been able to take that money that I would normally pay for the primary schools, and I'm, you know, giving it to the secondary schools. Of course, the amount of primaries for the amount of secondaries don't match, but what we are doing is we're able to pay for those families on universal credit. I mean, can you imagine in London, if you earn 7,000, you know, basically a year, you don't meet the threshold for free school meals. I mean, it's just ludicrous. So at least we can use that money to pay for free school meals. So as you can see, I'm a big fan about it. I would say, you know, that we could say, you know, it's not the silver bullet. You know, what can we do? We can spend a bit of time in these lovely surroundings, sucking on our pencils, wondering how you really get there. But actually, in the here and now, what better way? Schools, all our children go to schools. We can absolutely make sure that, you know, children are fed. You can't concentrate and you can't get good outcomes if you're hungry, can you? And I'm nearly there now. I do want to say that since we rolled this out, it's been phenomenal, really. It's been phenomenal results. Do you know that when we started on this journey, we were second, you know, in the bottom, joint second in the bottom in the league tables for education, our schools. And now we are 98% good and outstanding schools. Now, of course, good schools isn't just about free school meals. It's about great teachers, the pupils themselves, the carers, you know, but it's also about, you know, when people are struggling, getting in there and feeding hungry children. So, you know, I'm not basically trying to underpin everybody's, you know, ideas, because if there's a way forward, I'll be not behind it, I'll be in front of it waving the flag. But while you're getting on with that, I'll get on feeding hungry children, because the last thing I want to say is means testing. You know, when I grew up, I was given a token and I had to queue for school meals. And, you know, do you know what? I can't remember eating school meals because I didn't want the embarrassment. Whereas, you know, now, you know, basically you can, with universal free school meals, you don't get that, but you do get really great outcomes.
Well, we've definitely passed the first test of ensuring that the panel discussion was not boring. So I think that's, thank you so much. What an excellent range of views. And yes, there are a lot of different objectives in this space, whether it's education, educational attainment, thinking across the different phases of education. So it's not just young children, whether we're thinking about what else could the money be used for, should it be better invested in the benefit system or other things. I liked what you were saying, Kate, about something wider, maybe a sense of belonging in school, which I've actually kicked off some research in the Department for Education on now to really try and understand what that means from the point of view of children and how it compares internationally, because you know, school isn't just about achieving an outcome at the end, it's the whole experience, the sense of belonging, and if children can get to the end of their education and feel that it enriched their childhood, for me I think that's surely got to be worth more than sort of anything in a league table or whatever. So great range of views, lots of different objectives. Children, of course, are the future and have been disproportionately affected by the pandemic. So this is why it's a very emotive issue and a very important one. But let's open up to questions. And I think, Louise, you've been heroically gathering some questions from the chat. Should we start with a couple from the chat?
So there's a question from Kevin Morgan. As metrics often shape results, to what extent do the school food results discussed earlier depend on whether the object of analysis is the menu, the plate, or the bin?
You want to take that, or?
Well, and I guess you did this. Yeah. Actually, green and red. Okay, well, I guess you can get the answer to that from a mixture of my presentation and Jenny's and Marie's. Like our presentation shows the overall impacts. Jenny's and Marie's shows, you know, what's actually being served, and I suppose they might be able to say more about the amount of plate wastage or bin wastage that happens on the way. You know, all we can say is, you know, the overall impact of providing the meals has been to improve children's diets to a sufficient extent as to reduce obesity. Maybe they can say more about the quality, quantity, wastage trade-off.
Thank you. Yeah, I think it's a really important question, actually, and it's and I think definitely the best thing to do is to try and capture all of those in some way. In the research that I reported on, we did look at the menus, we looked at sales as well, and we looked at consumption. So we were capturing individual level consumption, which included food that wasn't consumed by the student. But something we didn't capture is waste at the school level, and I think that is something that did come up a lot in our qualitative research from caterers and schools, was the concern around having menus that incorporate lots of fruits and vegetables and lots of healthy foods, that they felt that there would be this trade-off with high levels of waste potentially, and so that did influence their decisions around what went on the menu, definitely.
Not much to add, but to say that my research was on individual consumption. Yeah, absolutely agree. To make it actionable, that needs to be compared with what's served and why it's often.
Oh, thank you. Should we take another one?
Question? Yeah, this one is from Deborah David, who is a registered dietitian. I think this one's more for the panel. How can we use this research to influence (brackets pressurise) local planning and positively influence the type of food outlets on our high streets? There seems to be an increasing number of outlets selling cheap snacks readily available to secondary school children outside the school environment.
A great question. Anyone on the panel want to take that?
No, this is not my area of expertise. Right, okay. I can add something.
Oh, okay. I mean, just on the, the chicken shops and the food shops, and they seem to be all focused near the secondary schools. I mean, goodness me. I mean, basically, my daughter's just gone to secondary school, and now she covets those chicken boxes like they're, something amazing. So we are absolutely, I'm sure they put something in it as well to keep our children going back. So obviously this is why working with local authorities, we have to work with the environment, and we have to try and reduce the amount of shops which are around schools. But it's quite, it's been very, very difficult. But one of the things that we've managed to do is within the schools, a free school meal offer is that basically make healthy options, and make good, healthy food. And I mean, it's interesting really, but when I remember when we were first looking at moving to, I see Urban Health here, and they're like really big fans of making sure that the food in the schools are very healthy. I just remember I was sat with Public Health because I look after education in schools, and they came in and I felt like they came in with their white coats and clipboards, and they were talking about my offer to nursery schools, and they were kind of saying, look, what we're going to do is going to basically measure the calorific value. We're going to make sure they get this and that. And I just thought, God, they're already feeding children. Just give them the money. Do you know what I mean? And I felt really proud that I cut through, but actually I was wrong. And I know I'm wrong now because we've really worked up this amazing offer, and all our children, we're rolling it out in schools. They get basically free school meals, but they get, healthy options. And it goes down really, really well. And with the secondary schools, before, the same Public Health people, before I was allowed to even spend a penny of that money that Sadiq gave in the secondary schools, they went and inspected all the kitchens to make sure that when they got the extra money in the secondary schools, we gave them a grant to upgrade their kitchens so they could give healthy options. So it's all interlinked really. If you can get that right in the school, you might stop the obsession with the snack shops. And obviously with the planning and regeneration, we can do a lot there too, but it doesn't seem like we're doing that quickly enough.
I think as well, when we talk to our young people, it's not necessarily just about what's around the school. I mean, that's quite a kind of a blunt instrument. I think, we hear a lot about what's on the way to school and what's on the way home from school. And the most important factor that drives children or teenagers to these outlets is price. teenagers are really price sensitive about their food. And if the chicken shops and the burger joints are undercutting school food, which they do, because they offer meal deals that are aimed at children, then that's where the children are going to go. So we need the food in schools to be delicious and attractive, but we need it to be affordable for children as well.
Yes, Caroline, that's quite right. My daughter, who's 17, talks about the McDonald's 99p burger.
Yeah.
So
and they get an offer on the app every day for it. Yeah,
exactly. So, did you want to say something?
Yeah, I suppose just one thing to add is about kind of what's on offer in school, and of course we know we want that food to be healthy, we want it to be good quality for all children. I suppose one thing I'd just be cautious of is making sure that what's offered in schools and limitations that we put on food, it doesn't just apply to certain groups. So I suppose just to give an example of that, in our research we often speak to children who say because they're eligible for free school meals, actually they're not allowed to use their allowance to buy a cookie, but their peers who are paying for food are allowed to buy that food. And another example is just the option, for someone on free school meals goes to the counter, they have to take up the meal that's on offer, they can't get a grab and go, whereas if you're paying, you can. So I think there's just something about making sure that the experience is really equal for all children. And if we're saying that certain foods are good for kids, then that should apply to all kids, and we shouldn't be sort of, limiting the choices of children because they're on a lower income.
That's an excellent point. Thank you. Should we see if anyone in the audience has a question? We can come back to any online questions. Oh, yes, please. Oh, no, don't.
Thank you, Miles Bremner. A question about the evidence base. Is presenting a multitude of benefits potentially presenting a panacea for all ills? And is that more of a problem than being able to laser focus on one particular benefit, be it about health or attainment? And then a slightly cheeky second question for Ben at Impetus. What do you think should be done about the universal infant free school meal policy that every single political party has backed for a number of years and has been in place? So there already is a universal free school meal offer in our educational system. Do you think that that should be stopped in benefit of other policies? Thank you.
Okay, well, should we answer that one first and then go? I mean, just in terms of presenting evidence to government, I think it's really how it's presented and sort of how clearly it is. So I think the evidence here for me was reasonably straightforward, that there's a definite health benefit, and that was mostly driven by children not eligible for free school meals changing their behaviour and changing what they eat. And that also there's a secondary effect on learning, and that seems to be affecting all children, including those who are already eligible for free school meals. So it's something about the change in the school environment. So I think I'm sure there's some nuances I haven't got, but I think that's pretty good to communicate to government. And then of course there's the trade-offs of what is it going to cost and all of that. So I think it's pitched pretty good in this report, actually, and sort of quite easy to translate into policy. And then Ben, do you want to come back on the question about universal infant free school meals?
Yeah, I mean, just firstly, very quickly on the evidence question, I think a lot there depends on who you're trying to get to pay for it. One of my provocative suggestions would be, if you think it's going to improve health dramatically, ask the Department for Health to pay for it. They're already funding the school fruit and veg scheme. Maybe we can potentially even use some of that money and reinvest it in this. On universal infant free school meals, I'm not going to be as unpopular as you're hoping I'm going to be by saying let's scrap it. But I just want to be really straightforward that DfE has a national priority schools breakfast programme that aims to bring free and subsidised breakfasts to young people from disadvantaged backgrounds. That's currently due to expire in the summer. Big open question about whether that is going to continue to be funded. Right now, as it stands, next year the DfE will be paying for lunch for millionaires' kids if they're in infant schools, and won't be paying for breakfast for poor kids. That's a choice. That is a choice.
I do find it odd that we do fixate on, so we don't means test other parts of the school day. We're not sat here talking about removing provision, other bits of the school from certain children. So it's interesting to me that we somehow are okay with kind of dividing children up at lunchtime by household income and giving some meals and giving others not, but we don't apply this anywhere else. And I think if it had always existed, we wouldn't be talking about taking it away. But yeah, and I appreciate there are decisions to be made when you're talking about limited funding, but this is about investing in children. And I think breakfast clubs should also be heavily invested in. We know there are many benefits both for children, but also in terms of families getting into work and being able to work more, particularly for mothers, from our evidence. So yeah, I just find it this interesting thing around kind of why do we want to means test lunchtime?
And we've got another question.
Thanks very much. Mari Burton from the National Education Union. Firstly, just thank you to all the researchers who've given really fascinating presentations. And I was particularly interested in hearing about the many benefits that happen to children who, I guess, I don't want to say aren't affected. The whole point was that they are affected by this policy that wasn't going to impact on them initially. And I think it's been really, really interesting and very exciting to see the wider benefits this can bring to all children. So I think somebody said earlier how it raises children out of poverty, but it also, it lifts everybody up as well. Yeah. But on top of that, also very interesting to hear about the secondary school research, and one of the issues being kind of time constraints and the idea of actually secondary schools in particular. Full disclosure, I used to work in secondary school. I used to be a history teacher, so I certainly remember this idea of having to really rush through the school day, lunchtime not being a priority. I think there was an example of just like having 2 sort of short breaks, which you do think is a bit mad when you think we all probably are working in offices where you do actually get an hour, hopefully, for lunch. Again, I work for a trade union, so if you don't, then you can. So I guess my question really is kind of one about priorities. I completely agree with the gentleman on the panel saying that actually schools cannot fix poverty, but I think are all agreed that they're in a very good position to be able to make a very positive impact on children and their families. So tying in again with the panel agreeing that children shouldn't be going through schools and the purpose for school shouldn't be to be at the top of the league table, but secondary schools are structured in a certain way because the priorities of education at the moment is about high stakes testing, is about passing exams. That then impacts on how we have children throughout the whole day. That's how we deliver that education. And I think lunchtime is a very interesting kind of focal point for how there can be lots of real benefits if we maybe shift that perception. So I guess it's a very wide-ranging question in that actually could the priorities of schools, or could maybe the Department for Education's priorities of schools shift slightly, which could make schools be in a position to give a better kind of holistic care to those children and those families. So a very wide question to whoever in the panel would like to answer that.
Jasmine, did you want to come in?
I'll come in a minute.
Sorry,
I'll go first.
Did you, Caroline?
And no, and just to say, I mean, I completely agree, as a parent of teenagers as well as representative of young people. I think, there's always been talk with Ofsted, hasn't there, around, should they be looking at kind of well-being measures, like much more holistic measures, and I think like food and prioritising everything that we know about the importance of coming together, and that social aspect of food for young people would be an amazing thing. So yeah, let's do it.
Yeah. Yeah, I mean, I agree. I mean, it's you've raised a big question there, haven't you? And I think in Southwark, I mean, obviously keeping with the theme of food, but also looking out, we've got 10,000 children with special education needs and disabilities, and only 3,500 are on education, health and care plans, trying not to use acronyms. And, basically we do need to completely look, at how, holistically. Otherwise, I think it probably chugged on, didn't it, until, well, that's just my subjective view. But then after we had COVID, and basically we had at the younger age, children coming in, not being able to form, in the early years sentences. And then you've got basically children that are doing that crossover from primary to secondary, just being really disorientated. It just feels like, there's more evidence, and food being one of them, but plenty of evidence to back up your assertion, really, that we must look at it holistically.
I think there's quite a lot of practical constraints as well, that sometimes when schools have expanded, they haven't actually expanded their canteens and those kind of facilities. So I think that's quite a lot of the constraints, that even if you put in policies in place to have more free school meals, whatever, actually is the capacity there. And I do think I do think a lot of it in terms of the queuing and rushing at lunchtime is quite practical constraints about schools having expanded in numbers, but not being able to increase those fixed facilities for whatever reason. I'm not judging why they didn't do that, but yeah. Should we get?
Sorry, it'd be weird not to talk about holistic schools without also mentioning, mental health is a massive problem. We fund a number of charities supporting young people at risk of exclusion. Like, we know that the way the incentive structures are built for schools are like not necessarily perfect for promoting inclusion. So yeah, like there's lots of good stuff we can do on that.
Indeed.
Oh, okay. Well, I'm just going to let whoever's got the microphone just choose, because
Thanks. It's just a comment really, which is that I agree with very much with that, and it may well be that their schools are rushing children through because they haven't expanded their facilities. But we did also fund some work looking at the length of break times over the decades, like 10 years now, 10 years before, and 10 years before, and breaks have contracted significantly in secondary schools. There's a significant number of secondary schools where lunch is only 30 minutes. So no matter what your facilities are like, that's going to end up in rushing by the time you get things to your locker and try and make it to lunch and back. And I think the link to mental health is also really important, because it strikes me that if you have half an hour lunch and you're rushing, your ability to just decompress from your lessons and engage with your peers and it just must make a massive difference. And so I think that's an important factor to consider.
Great.
Sean Turner from School Food Matters. I think every panelist now has spoken some way in about there being trade-offs and some sort of financial limitation on policies like this. It's not true. There is not some sort of fixed amount of cash that we can have. And actually, I think while we continue to limit ourselves by the idea that there is some sort of fixed envelope, limited by the amount of money, then we're just going to continue squabbling amongst ourselves. And actually, there's no reason why we can't get rid of the 2-child limit and fund free school meals for all children and pay for maths lessons, etc., etc. So I don't think we should continue squabbling amongst ourselves because of this framing.
You for Prime Minister.
I mean, I think there's still a trade-off in terms of then you need to raise tax.
No, I don't think that's true.
How do you get the money?
Well, you can borrow it, you can sell bonds, there's loads of ways you can raise money as government, but you don't tax to raise money.
I think we might have to beg to differ on that one.
Yeah, I could refer to some work that would show that.
As a more practical point, like leaving aside the question of whether that's true or not, I don't see any frontbench politician of either of the major parties that's like to form the next government taking that view. So like we could sit here for quite a long time and try and work out whether that's true or not and what we would do if it is true. It's just, I don't think that's on the, as a policy person, I don't think that's on the radar for the next 3 to 5 years.
I agree that there is that lack of understanding and vision on the front benches, but it doesn't mean that we need to continue squabbling about what's more worthwhile between ourselves. The politicians can make that decision once presented with the various options, but I don't think we need to say that one thing is necessarily more worthwhile than another.
Well, that depends if you actually want to change something in the next 3 to 5 years. Like that's the choice we face as policy people, right? Is we can either come up with what we think in theory should happen and keep banging the drum of it for 50 years if we have to, or we can ask ourselves, in the system and the politics that we're operating in, what are the feasible changes that will actually make a difference to young people while they're still actually young people? And again, there is a trade-off there.
Actually,
do you want to come in?
Yeah, I'll just come in and I'll try and keep it brief. But what's wrong with having aspiration? I mean, I remember when I first became a cabinet member and I was a little bit naive, but I told a packed meeting that I'd be supporting 100% of their children with mental health needs, as opposed to the NH target 35%. And it was quite a warm reception when I got off the platform. But then, we put our money where our mouth is. We put 2 million into schools and we basically opened up a free mental health drop-in, which just more accident than design. We were able to open it during the middle of the first lockdown. So online at first and then, you know, basically a bit later open its doors. But the point that I'm making is, you know, I understand what you're saying. I mean, the Labour Party cares my leader, but, you know, I think, you know, basically if people do raise aspiration in circles, if we don't hear aspiration here, where are we going to hear it from? It's not always a bad thing.
Well, thanks for stimulating debate. That was great. Anyone else want to come in with a question? Oh, we've got someone at the front. Okay.
Whilst we wait for universal free school meals, which will happen because we'll keep talking about it, one of the things we can do, just to Ben's point about pupil premium, is auto-enrolment. So as a first step, so that the children that are entitled aren't missing out on free school meals, and the schools that are entitled to pupil premium don't miss out on that funding, isn't that something we can really push hard on? I know that my colleague Miles Bremner behind me has done some very powerful work on this, but if we're looking for a practical solution that we can do right now, Ben, there's one. And then we can look for universalism, because that has to be the way forward to take the stigma out of school food.
And to go one better, Lewisham have done some really cool work where they've identified from their own data who is theoretically eligible for free school meals and not claiming, and they've used that data. They've essentially written and said, unless you opt out, we're going to enrol you for free school meals, and they've unlocked over £1 million a year for their school.
Many other councils and local authorities around the country, so it's happening already.
Yeah.
We just need to switch that policy switch on and make it happen. Kate.
Well, just an important point about the Lambeth findings were that the children that hadn't signed up for free school meals were disproportionately children from ethnic minority backgrounds, families with disabilities. So I think, again, it begs the question of where we don't have auto-enrolment in place, which are the families that are missing out? And those families are disproportionately kind of affected by other disadvantages as well. So, yeah, I think we all feel that auto-enrolment is one of these things that we can't quite believe it hasn't happened yet.
Yeah, indeed.
Thanks. And yes, Hugo and others have talked to us about that. So, but just on your research, Hugo, I was struck by the fact that when free school meals became universal for everyone, those people, if I've got this right, the children who were eligible for free school meals but didn't take it, that actually didn't shift very much. So there were still, most of those children still didn't take a free school meal when it became available universally, if I have read your results correctly. So parents don't necessarily want it forced upon them, is what I'm saying.
Okay, so yeah, what we were showing was most were already taking up free school meals. When it was made free for everybody else, the change was about 1 in 8 of that group of children who could have a free one if they wanted to, but they didn't. They shifted into taking a free one. So yeah, there was still this hard to reach group who, for whatever reason, were still turning down their entitlement to a free school lunch.
Just as a quick add-on, some emerging evidence which is coming from the evaluations from the London Mayor's primary free school meals, and also in Tower Hamlets where they've rolled out secondary universal free school meals. The uptake from the operational till data is showing quite a startling increase in the take-up of meals by those pupils who were already entitled to free school meals. And I think there's something around how schools record take-up data on the 3 census days, because it's sort of linked through to the presentation of, it's often used as a proxy for how schools are responding to disadvantage. And then for universal infant free school meals, it's a very live funding proxy. And so the operational take-up rates in the census data is often perhaps slightly higher than the actual, and I think that potentially masks the real take-up differential that happens when you have a universal offer. But that hopefully in the next few months there'll be some good data coming through both at primary and at secondary school to show that.
Yes, please come in.
Hi, I'm Birgitta, Rabe, working with Angus on the work that was presented today. I wanted to get back to the results on obesity that we find in this study and also the previous one where we look at infant free school meals, because I think we haven't really stressed very much how remarkable that is, that we find anything that can do anything about obesity. Okay. So obesity results, scouring the literature, there isn't that much that you can do to change obesity. And this is something that I would say to you, Ben, if we're thinking about should we restrict free school meals to children, you know, the poorest children, and we could discuss about the thresholds there and all of it. But in our work on the infant free school meals, what we found is that children from quite a wide variety of backgrounds were actually benefiting. We did not have individual level data, but we were looking at schools with high and low proportion of already free school meal eligible children. And what we conclude from our discussion about universalism, is it good? Are we wasting money? Are we feeding millionaires' children, as you say? Is that the middle income groups, we find that reduction in obesity as well. And maybe those families don't have a restriction in what they can afford to put in the lunchbox. Maybe they just don't have the time to make better food. I mean, there is research showing that as mothers work more, they perhaps have less time to faff around with baking wholemeal bread and all of that stuff. So, which, you know, I do appreciate people doing that, and I do it myself, but, you know, yeah, what I want to say is that we have an obesity crisis. It's got worse through the pandemic. The trends are going up. We know it's very much related to poverty, but we also know that it's going beyond, you know, the poorest groups. And I think the fact that we find something that can address this, even if, you know, a small change, it is so hard to shift. I think that's quite persuasive to me. I mean, of course, cost benefit and all of it, but we do find the middle income also benefiting the children. And I think that we don't know the long-term effects. It's very hard for us to, as Angus has said, to research it. But, you know, even less time spent in childhood being overweight and obese has long-term positive health implications. So I think for me, that is the strongest point here. I agree that the learning is kind of a bonus add-on. It's a small effect, let's face it. But the obesity, that's big to me.
Thanks. That was an excellent point. I was very struck by that in the research as well. And having come from a poverty background, I was immediately looking to see, you know, which were the children who just missed out on free school meals who could now get them, and all of that, which we did see. But to see the obesity effects as well, really quite persuasive. Anyone want to comment on that, or?
I think as well as another point that I'm going to assume that the school food standards were kind of monitored across the schools that you were researching, and we know the school food standards don't currently match dietary guidance, particularly on free sugars and fibre. So if the school food standards were updated and monitored, and we knew all schools were compliant, those results could potentially be even bigger.
Can I just push back once more on this idea of, I know it slightly wasn't the point being made, but on sort of feeding millionaires' children. And I think that's not an accurate picture of kind of what's going on in state schools at the moment. We ran a survey with school staff across England, and across the board, I think it was kind of 90% of school staff in every role are seeing kind of poverty and hardship increasing. And that plays out in different ways. You know, children not have their teachers having to find food in the morning, source uniform, fill out hardship grants, kind of source local mental health support. There were many different ways in which schools were kind of stepping into this role, because there is this increasing level of children and families struggling. And we're not talking, of course, we sort of know about the very poorest families, but that even sort of middle income families have been struggling in recent years. So I think, yeah, just the way that we talk about schools and the families and children that are in state schools, I don't think we're talking about schools filled with millionaires' kids. I think we're talking about a lot of families who are just on the cusp and kind of struggling to get by. And that's why this kind of universal provision has this effect of kind of helping out lots of families across the income spectrum. and will have that kind of disproportionate effect on lower income families.
Yeah, and just to be clear, I was being deliberately
Yeah,
provocative.
Of course, but
I think we could probably have a really interesting conversation about like, where do you want to draw the line there? How much kind of money do you want to give schools where they've got flexibility, whether it's food, whether it's uniform, all of that kind of stuff. I think there's some really interesting questions about like what schools can do to kind of support. But yeah, the millionaires point is a flippant one, as I think, just to be clear. One thing I would say is it's perfectly clear that the one thing that would make everybody on this panel happy, including the DfE, is universal free school meals paid for by the Department for Health.
Definitely get on board with that. Yeah, so at this moment, I can now plug the household below average income publication that the DWP puts out every March, and that will show the income distribution for you, and you can see how many millionaires there are. And actually, you can see where you are on the income distribution as well, and probably feel a lot luckier than you would if you didn't look at that. Should we take one last question from the online?
Yeah, well, I could sort of combine a couple of questions because they're sort of about
very efficient
nutrition in school food. Matthew Knight asks, can we strip out profit from school meal services and encourage in-house catering in primary and especially secondary schools so children are able to make smarter choices at lunchtime and not encouraged to buy and consume higher profit margin, less healthy food? And on the same sort of lines, there I've got a question from Hannah from Magic Breakfast. Let me just scroll through all of the other things that aren't important. Oh, is she?
I can come off mute and ask the question if you like.
Yeah, go and ask the question.
Hi, thank you to all the speakers, it's been wonderful. Unfortunately, I missed the very first 15 minutes, so hopefully this hasn't been covered, but my question really was, how involved are children and young people in the design process and the promotion of school meals via the universal free school meals model? Because it seems that policies that involve peer groups and that's this kind of peer design. I know, you know, School Food Matters is a great example of this, going into schools and kind of putting young people at the forefront of promoting certain eating behaviours, and really listening to young people's voices may be more effective at engaging the young people to the food that's on offer. Obviously, it has to be within certain nutritional guidelines, but I just wonder if that has been factored into to this universal free school meals model.
Yeah. Anyone from the panel want to?
Yeah, sure. Yeah, I can go. So in terms of the work that we do in talking to children and young people in schools, there is a real feeling among young people about the importance of it being universal and being fair. We do find in schools where there is really good sort of pupil engagement and involvement in designing menus and understanding what children want to eat, making sure that it really aligns with the kind of cultural preferences, dietary requirements of children in that community. We see the kind of take up is a lot greater. So yeah, I do think there is a correlation between having children really involved in that conversation at school level and wider. It can really lead to these sort of the benefits being maximised. But yeah, that's from our research.
Yeah, and in Southwark, I said about the a caricature of the public health person that's leading our free school meals, who Miles knows quite well. But she basically has taken me out to some of my schools, and she showed me that, you know, they're basically at the primary, they're feeding chickens and everything, they're having discussions, they're growing food. Not all of it, obviously, that would just be, but you know, but they are, but just too idyllic. But they are, you know, they're having a different relationship with food, and similar with the secondaries. They couldn't get that extra money, you know, to feed the children on the universal credits. Unfortunately, I didn't have quite enough to roll it out universally in secondary, but we gave grants to those schools to expand their kitchens so they could give healthy offers. And you know, I went down there the other day with ITN, and some of the, you know, the children that came forward in the secondaries talking about the fairness and everything and the healthy options. It was pretty impressive, really.
Thank you. So how are we doing on time? Should we wrap it up there? All right, great. Is there any last comments any of the panelists wanted to make? Anything you wanted to say that you weren't able to say? Oh, yes, please, Jasmine.
Yes, I mean, apologies for Mary and people who've heard this quote before, but, you know, on this issue about universality and, you know, basically whether you do that, I've got basically 3 MPs in my constituency, and one of them was the late Tessa Jowell, and she always talked about universal everything. You know, it's very old Labour principle, but she always said, you know, that services which are just made for the poor make for poor services. And she was the architect of perhaps the most famous universal service to date, really, Sure Start. So, you know, I always think about that. And then going into our schools and seeing it being, you know, quite equal, I think, you know, it's so important. And it saw us through austerity, and it's helping our families through, you know, the cost of living crisis. So, you know, basically, I really admire you for all the work, all the academics here, but, you know, you've got to keep one eye on, you know, the delivery, really, and it should be universal. Sorry, Ben. Oh, you're not.